many of us that work in this field from a Christian perspective, we have that compassion, that connection, and that trust within the community. And see, I think that's so important. It's almost like with some of these big foundations that fund large technologies, if they don't have an entree into the community, what good are those technologies? And I think that's the piece that many of our organizations can bring.
One of the things that we need to do is listen to those who criticize us and learn from that. I would question whether, just on the health projects I've seen, on the whole, Christian health projects really are sloppier or less effective than that of a lot of secular agencies. There's a wide range on both sides. Data helps to be able to demonstrate the fact that we are effective. And I think that's part of what we're able to do. Increasingly, we can look at the child survival mechanism, we can look at PEPFAR, all of which follow more or less the same monitoring and evaluation methodologies. We can compare our results to those of others and say, is it really worse than the other agencies? Often, I think the Christian projects tend to stand out for their effectiveness. I think part of it's in our own thinking as well. I remember going back to UNC at one of their alumni groups and talking about the fact that there is no such thing as a valueless-based approach, a truly evidence-based approach that has no values as a part of it. If you go in to change people and change their behavior, you're doing it for some basis. To say life is good is a value. To say that people should survive is a value. To say that one life has value simply because people are alive is a value that not every group would agree with. We have a coherent value base, and we have one that enables us not only, as we define transformation at World Concern, it involves an external and internal change. If we have a health program that has gone on for 10 years and people are no healthier than they were at the beginning, we're not transforming lives. We may have a church, but we haven't transformed their lives in regard to health. On the other hand, if we do not begin to change worldview of people in terms of their attributional patterns as to where health and disease comes from, their understanding of attribution, the fact that somebody who is malnourished is not malnourished because they're sent by spirits, or somebody who is dehydrated, it really is related to the lack of water going into them rather than having a spiritual cause. That the actions that people take will help improve their health, and they know that it's their actions. Should I tell a story? Okay. Again, from the same program that was at Meet. You go, when you have a very successful program and you have the data and you know that it's been successful, and you're going around and you're sort of, you've done the quantitative part of the research, so you're having focus groups, you're talking to leaders and that sort of thing. You listen. And when you ask the question, what's changed, you of course get what you already know has changed. Fewer children are dying, women are living longer, our children are healthier. But then you continue to listen. You say, well, what else has changed? And at one point they said, well, there's far more peace in the community. I said, oh, tell me about that. And he said, well, you know, there are so many children dying. We knew that there had to be, upon the kids. Our women who are pregnant would not go out for antenatal visits because of the fear of some childless woman having seen them and placing a curse upon them, or going to a witch to have a curse placed upon them, so they would not go to antenatal screenings. They wanted to keep their pregnancy a secret. And in fact, it got so bad that we sent everybody out into the bush one day, and our traditional practitioner went through to smell out the witch. And we found the witch, and fortunately they didn't kill him or her, but drove them out of the village. He said that, you know, the deaths and the illness did not really change as a result. Said, in fact, that our funerals have changed. When we have the funeral, they're still very long, particularly if somebody dies in an untimely way, such as a child. And we used to gather at the funeral over those days to say, okay, why did the child die? We would say, was there an ancestor who was offended? Was there somebody that placed a curse? He said, the funerals have changed. We're now asking, well, did the child have a fever? Do you think it was malaria? Once the child had the fever, did you take him or her for an early diagnosis? And in this case, some presumptive treatment even for malaria. A vast change in the perspectives of the people before. Previously, you could assign attribution backwards. You could say, after the bad event happened, we can go back and begin to understand why it happened, but basically what it is outside our control. Now they're looking back and saying, okay, in fact, the presumption is, and the presumption is a worldview, that the parents, the caregivers could have done something. Very, very different worldviews. We have a coherent, besides the compassion that is often there as a part of it, we have a coherent, value-based worldview that is very conducive to health. The idea of dominion, of efficacy, the idea of the fact that the lives are of value simply for being alive, not for their productive capacity. That people have value and they have equal value in the image of God. What do you do with health without that value is a part of it. So, yeah, I think we do have some answers.
In response to our detractors, and we'll always have them, I mean, I think the church historically was designed to be maligned, it seemed. And the example of Christ, when he was maligned, was to be quiet, to just say, wait and see, and judge for yourself. And I think our message to our detractors, if they're judging us, if they are demeaning our programs because they are Christians, that's on them. They need to go and see them. There's some excellent work coming out of the field, and some of it happens to be from Christian agencies. The example that Meredith gave about this program, this child survival program in Mozambique, the care group model came out of that program. The care group model is now the standard at USAID, and many agencies, I was in Malawi and Save the Children was saying, oh, we've got to learn about the care group model. Do you know about the care group model? I said, yeah, I watched it be born. But so I think our response to them is to respond as Jesus did, to not be defensive, bear with them in patience and humility, and just say, come and see, come and judge for yourself.
Yeah.
Oh, and one more thing. The message to us is to strive for excellence.
Yeah.
We all have it in us. There are some incredible practitioners and minds in this room. There are, I'm looking at them all around me. I mean, and we shouldn't be ashamed that we also happen to be Christian, and that's what compels us. We shouldn't be ashamed of that. But we all have to do it as unto the Lord and do it the best we can. And If we get applause, great. If we don't, we've still done our best.